I'm fired up and I'm ready to go. I'm fired up and I'm ready to go. I'm fired up and I'm ready to go. This is the Billionaire Brown experience. Let's go.
What happened? It was the repeal of the individual mandate penalties.
Yeah. Basically, the repeal of the individual mandate was in the tax bill. Now you have to kind of go back really to about 2012 to really understand it. But when the Affordable Care Act originally passed, it wasn't a tax; they called it a penalty. It was a penalty for not buying insurance because they said they weren't going to, increase taxes for people when they passed the law. So it was a penalty. So it went to the Supreme Court in, I believe it was 2012, or thereabouts, and Justice Roberts, in my opinion, he illegally rewrote the law. He said, well, no, it's not a penalty, it's a tax. And the government has a right to tax. So then it was a tax. So now that it's a tax, now it can be, applied to a tax bill. So when they rewrote the new, the Republican new tax plan, that was one of the things that they did was repeal the individual mandate because now it's a tax. So now it's a tax cut.
Okay, and you've been in the industry for how long?
14 years.
Okay, 14 years. And in your opinion, is this good? Is this bad? Was it better before it was repealed? Or what's your thoughts on it?
I think it's going to be really insignificant because right now, almost 7 million people are paying the penalty now, right? Because they don't, they can't afford insurance or don't want insurance. There's another probably million people that have found alternative ways to, be exempt from the penalty, whether it be by loopholes in the system or by being members of a Christian ministry. So there's 7 million people right there, or 8 million people that are out of it already. The Congressional Budget Office is saying that an additional 10 million people will drop out of the market because they don't have to have insurance. I don't know if I agree with it. I think people who want insurance are buying insurance. People who don't aren't. There might be a handful. You might find a handful of people there who drop out. But as a constitutionalist, I don't believe that the government should force you to buy anything that you don't want. So from that side of things, if I don't want to buy insurance, you should not make me buy insurance, and your insurance act shouldn't tell me what kind of insurance I have to buy.
And then you shouldn't say if I don't get it, you need some money for it, right?
Right. Well, and most of the people that are not buying that are affected the most are the lower middle class. The people who make too much to qualify for us, make $37,000 a year, where you make just too much money to qualify for a subsidy, and then you have to foot the bill for everything yourself, which an individual's health insurance plan is now probably $600-700 a month for somebody at that age, and if you don't get what they call an advanced premium tax credit, you're footing the whole bill, and that's too much money for somebody making $37,000 a year. So they're the ones that are hard. The lower middle class, I would say, are the ones that are, affected the most by this. It's a tax on them. So the good thing is now those people can buy a short-term plan or an indemnity type plan, starting in 2019, which would still be insurance, maybe not as good of insurance as maybe someone would normally recommend, but still a good plan, and now not be penalized for it.
Okay, so you're over at isellinsurance.com, right?
iSellHealth.com.
Okay, iSellHealth.com. Okay, and so you're saying nothing is going to affect your business at all. And you essentially give us an idea of what exactly do you do in the insurance industry?
Well, I'm a health insurance broker to start with, so I sell policies, with whether it be Blue Cross or United Healthcare or National General or indemnity plans through Philadelphia American or any type of company. I broker health insurance plans, but I guess more importantly, I've kind of become a healthcare policy wonk, so to speak, which is probably why you and I are speaking right now. And I just study these laws, and I've learned that you have to, in this business, the laws change a lot, so you have to understand what's happening because there's always a lot of moving parts. And if you understand how the laws are written, you understand how to help your clients the best.
Okay, so how are the laws written?
Well, right now, the Affordable Care Act is still the
I
law.
heard that the Affordable Care Act was it's like hundreds of pages or thousands of pages long, right?
Yes. The original.
Read that.
You know what? I did read the original. The original. They've made a ton of amendments since. I haven't read all the amendments because the amendments are probably as tall as iron if you stack them up. But when the original law was written, I did read every page of it. It took me about a month to read every page of it. I didn't understand every word of it because I'm not a lawyer and some of it's legal mumbo jumbo, but I got the gist of it, and I read every page of it. Now, obviously, our congressman did not because you heard Nancy Pelosi say you have to pass this to see what's in it. So they didn't read it. I read more than they did. Granted, I didn't do it, on Christmas Eve when they were trying to pass the law. I read it after the fact, but that's another issue is, a lot of things in the Affordable Care Act were never needed because we had laws on the books like HIPAA. No one understands HIPAA. In HIPAA, when they were trying to sell the Affordable Care Act here, they said, well, insurance companies.
And what is HIPAA? What does it stand for? Is that an acronym? Health Insurance
Protection and Portability Act.
Okay, go ahead.
I'm sorry, Privacy and Portability Act. And basically, HIPAA for the most part deals with your privacy, meaning you can't tell people certain things about their health status. Like if you were declined for insurance back then, the insurance company couldn't tell me why you were declined. They could tell your doctor, they could tell you, they couldn't tell me. They could tell you, but they wouldn't tell me. I was a broker on the case. Well, people don't realize that deals also with protections to the consumer as well, in so much as it said back then, and I believe it was Section 2742 of HIPAA that stated that you could not be canceled by your insurance company, because you got sick. And people no one understood that. They kept saying when they were trying to sell the whole program, well, your insurance company can no longer cancel you because you got sick. Well, they haven't done it since 1996. When the law passed, when HIPAA passed. So I kept saying, not only did Nancy Pelosi not read the Affordable Care Act, she didn't read HIPAA either. Because, or any other, not just her, any other congressman either, because not any time during that debate did anyone ever say, we already have that in place. Those protections are already there. So,
wait, what protection? The protection that if you can't be canceled?
You cannot be canceled once you got sick. Because that was one of the things when they were trying to sell the Affordable Care Act to the American people. They were saying that insurance companies would cancel you because you got sick. That was false.
Yeah.
They could rescind the policy because you weren't honest on your application, but they couldn't cancel you because you had a heart attack 2 years into the policy.
Okay, do people need health insurance in your experience and from your perspective? Do people really need insurance?
Well, yes, but here's the thing. This is where health insurance went wrong. I mean, if you look at your auto insurance, it does not pay for an oil change, but I bet you get your oil changed every 3,000 miles. Okay, health insurance went wrong because I can pay $100 to see a doctor or $75 to see a doctor. What I can't spend is $200,000 because I get cancer or a heart attack or get hit by a bus, God forbid. So that's what you need insurance for. They really went the wrong way. With the Affordable Care went way the wrong way because it concentrated more on the preventative care. And yes, you can make the argument if you take care of yourself and you catch diseases and stuff earlier. Yeah, you can make that argument, okay? But if you eat right and take care of yourself otherwise, you might be able to do the same thing. But what you really need insurance for is in case you get something, if you get cancer, or if you have to spend 2 months in the hospital for something bad, brain surgery. Brain surgery is probably $250,000. So that's what you need insurance for. You don't need it for. Insurance has to be just like your auto insurance, just like your homeowner's insurance. Insurance should be for things you cannot pay for yourself. And that's where health insurance went totally wrong, because they're making health insurance for things that you can pay for, and that makes no sense to me.
Okay, and the most important part of, like, what should be included if you were to be able to design a healthcare package? What are the key things, the mandatory things you personally would put in a healthcare package? Because I noticed that with the care that they're talking about now, they don't include dental. Like when they just had the requirement of what you need, dental was not included. And everybody knows that most healthcare. Okay, well, in general, most healthcare problems that we all have start in the mouth, right?
Right.
So I'm interested to know, like, if you were to create a healthcare package, what are some of the the key things that you would say have to be in your healthcare package?
Well, for me, and I go back to the things I can pay for, what I can. Okay, I mean, I funded my kids' braces. I paid cash when I see the dentist because I can usually negotiate a good price, or I actually have a discount plan as well. That
Wait, you paid cash? You paid full price for your kids' braces?
Well, I mean, I had a discount plan, so my discount, my discount dental plan discounted the braces, and then I paid cash on top afterwards. So
okay, keep going.
Yeah. So I did that, but for me, the biggest thing is the catastrophic. Hospitalization and prescription. Those two things are the things that have got to be in every plan because they're the things that can get expensive. Anything else, I think, should be offered. I think you should offer maternity coverage, but I shouldn't have to buy it. Right now with the Affordable Care Act, every plan has maternity coverage. If you're a 62-year-old male or 62-year-old female, for that matter, you're paying for maternity coverage. That makes no sense. I mean, because I don't think you need that. Every plan with Obamacare now has mental health coverage. And you're paying for that. I mean, in my world, you set something, or in my opinion, in my world, I would set up a plan with a catastrophic plan, maybe a $5,000 or $7,000 or $6,000 deductible, whatever you can afford, and you pay everything up to that point. And I'd have everything else, I'd have everything count. I'd have dental count toward that, I'd have vision, because, you look in your eyes, you get a lot of looking in your eyes too. Vision count toward that, prescription, everything counts toward that, and then you hit that number, and then you're done. That's 100% coverage. That way, if you get a chronic illness, then, $5,000, or whatever number you pay. Back pre-Obamacare, World Insurance, neat company, smaller company. They had a plan with, it was a $20,000 deductible, 100% coverage thereafter. Didn't sell many of them because most of it didn't have $20,000, but some people did. And the plan was like $50 a month, for premium. It was dirt cheap. And if you can save $300 a month and put it in an HSA kind of thing, maybe you're okay. So, and I'm a big fan of the health savings account, using that for your other stuff. Like me personally, I use.
Why are you big on health savings account?
Well, two things.
And what is a health savings account?
I'm sorry. A health savings account, or HSA, is tied to a high deductible health plan, which it has to be. Not all high deductible plans are health savings account qualifying, but some of them are. So, with a health savings account, like in my case, I have a qualified health savings health plan, which is a catastrophic plan. It's a $6,000 deductible, 100% coverage thereafter. And then, you have a separate side account, which for a family, you can put up to $6,750 a year into that account. Okay. And in that account, you put that money in there, and in the old days, you had the flex spending accounts where it was use it or lose it. With a health savings account, first of all, you're getting a $6,700 tax write-off, first of all, which is big. But the other thing is the money rolls from year to year. So money goes in tax deferred, it comes out tax deferred, or goes in tax free, comes out tax free. But more importantly is, if you don't use it, it just sits there for the next year. So if I put in $6,750 this year and I have no medical expenses, I can put another $6,750 in next year, and the year after that, and the year after that. And actually, they increase it every couple of years too. But generally speaking, they put it in there, and then I use that for all my medical expenses. So I use my HSA for my dental. If I go to the dentist, which I go to the dentist twice a year, I pay that. First, I have a discount plan, like I mentioned. I have the discount plan handle that, and then I use my HSA funds to pay for it. So basically I'm getting a tax, basically I'm